Good afternoon. My name is Stockie. I'm a licensed professional clinical counselor and a licensed master's addiction counselor in the state of North Dakota. I'm proposing implementing the ACEs screening tool into routine appointments with primary care providers. This implementation will be the first step in moving Southwest North Dakota providers towards a trauma-informed approach to care. Today, we will discuss why screenings are important, how they can be useful, how to screen for trauma, how to incorporate these screenings into routine appointments, have an overview of trauma-informed care and primary care, and take a look at a couple of scenarios, and also what we can expect as a return on investment in regard to implementing this routine screening tool. Screening for childhood traumas can inform the provider and the patient of elevated risks for many health problems. The demand for trauma-informed providers has increased due to the identified long-term impacts of trauma on the lifetime of a patient. Some of the long-term impacts can include social, emotional, cognitive impairments, higher risk of engaging in health risk behaviors, increasing susceptibility to disease, and potential early death. When treating patients, providers gather patient history to help them diagnose and treat the patient with a person-centered approach. The ACEs can improve the clinical assessment of providers, increase patient education, and improve treatment planning for patients. The ACEs is the Adverse Childhood Experiences Trauma Screening Tool. This screening tool was developed to help predict health outcomes related to childhood traumas based on the frequency of answers to the questions. The ACEs identifies abuse to include emotional, physical, and sexual, neglect to include physical and emotional, and family dysfunction to include family mental illness, physical abuse of family members, divorce, substance abuse, and incarceration of a family member. Having an informational handout available for patients whose score warrants further education or understanding can help the patients understand what they may be at higher risk for in regard to their health and mental health. Patients' awareness of their increased risk can mean that they are able to implement measures to reduce those risks and improve their overall health. Patients knowing what issues to watch for can help identify early warning signs for a wide variety of health issues. These handouts can be given in appointments as a need is identified, or they can be available in waiting areas or lobbies for patients. ACEs is a self-administered screening, which means it can be given to the patient upon check-in for their appointment. The simple scoring guide on the one-sheet screening tool is easy to review at a glance. A short educational session can be given by the DBH on staff to help providers know what they are looking at, what they are looking for, and how it can be useful. Continued education can be provided as needed. A DBH can be utilized as needed when there is a high ACEs score to help give patients information and help with treatment planning and referrals. With the ACEs screening being one page, it takes very little time. It can be self-administered, meaning that it doesn't have to add to appointment times for the patients or providers. The simple scoring guide means that it can be done by patients or providers, and at a glance, providers can know if the education needs to be given to that patient. Trauma-informed care is an approach to care where providers take an understanding and trusting approach with that patient. After reviewing the ACEs screening tool, the provider should know at a glance if the patient has a history of trauma that would warrant a treatment approach that needs to be carefully thought through to avoid future traumatization. Let's watch a short video on trauma-informed care to get a better understanding of trauma-informed care. Let's review a scenario. A patient brought to their primary care doctor's office due to continued suicidal thoughts, accompanied by other complaints, sadness, fatigue, irritability, muscle aches, and more. In the waiting room, the patient is given the ACEs screening in addition to other standard questions per the hospital policy. A DBH can review or discuss the results of the screening tool with the provider to discuss treatment options and referral recommendations. The DBH can also discuss the results with the patient to identify the issues with depression, referral recommendations, and the health issues and risks related to increased ACEs scores. Referrals for medication management and mental health therapy are made. Follow-up with the patient can be done by the DBH to ensure that questions or issues with the patient's ability to receive or engage in services is addressed. Let's look at another scenario. A patient who continually presents to the ER with alcohol-related issues and has a history of incarceration due to alcohol-related incidents is referred to their primary care provider following a night in detox. The patient is given the ACEs before his appointment, and his high score warrants a DBH being brought in to visit with the patient about the results. The patient is given a handout regarding the ACEs and what their score could indicate. A warm handoff is made to a treatment facility for an integrated assessment to identify substance use issues and mental health issues. The DBH again reaches out to follow up with the patient to ensure that any issues or questions are addressed to ensure the best possible outcomes for that patient. Implementing the ACEs screening is not time-intensive. This change can lead to a more trauma-informed approach that can lead to a return on the investment in many ways. Curtailing treatment in a person-centered way with a trauma-informed approach will lead to a reduction in somatic complaints by patients, reduce the amount of emergency room visits a patient seeks out, and will improve their overall health. An improvement in a patient's overall health will reduce the amount of money insurance companies pay out for patients. It will reduce the workload on healthcare providers and will improve the quality of life for patients and their families, friends, and communities. If there are any questions or a need for more resources, please feel free to contact me or anyone at Open Range Counseling Center. We're excited to bring a trauma-informed approach to Southwest North Dakota.